I think population health status reporting is a big piece of changing the, sort of moving the agenda forward, if you will, on health inequity, because you know, if you don't measure it, you're not really going to know if it's changing. I think it's a topic that sort of fundamentally resonates with people, but they need the information, to be honest, to know really what the issue is and to understand the extent of the problem and to be able to sort of see themselves and their communities in that context. So I think, you know, reporting in general, whether it's like a periodic report or it's, you know, like I said, providing that information in other ways, is really critical for mobilizing that sort of public response, I think.
And using the health equity framework is particularly important because it can drive not only the programs that and the resources and where do we target our resources within a local public health, but it can also help influence the direction that our partners in the community, our external partners, the directions they take. So I think it's extremely important to regularly report back to our communities what's going on from a population health status as opposed to just an individual or acute care types of outcomes.
Or looking at the life expectancy of people living in core neighborhoods versus the affluent neighborhoods and having a 10-year disparity. That if you live in the core, you're going to live for, I don't know, something like 76 years, but if you live in an affluent community, you're going to live for 86 years. I mean, I don't know if those are the exact numbers, but that's unacceptable. So that kind of reporting really sheds a spotlight on those stark realities, and it forces people to make change.
And when you think about your regional health authority, and particularly the board for the district health authority, is there a role for the community health boards too? Because I think there's such a wonderful model here.
Absolutely. So it's probably one of the things that I'm most excited about with this report is that the community health boards in Nova Scotia already have a tremendous track record of engaging communities around health issues that matter to them. Right. And they've got the mechanisms in place for doing that. They know exactly how to bring a community together to talk about something. So we believe we're going to expose some of the topics that could be the fuel for those conversations. And we've already gotten huge thumbs up from our community health boards to say, when you have those topics, we know exactly how to bring them into communities in a way that's going to land. Yeah, it's fantastic. So really exciting. A great resource, yeah.
Throughout the last decade, the reporting that has gone on within our Public Health Observatory and its predecessor was one tool that gave these people who have been working on these issues for so long and are so dedicated to it, it gave them sort of the weapon that they needed to take to all of these, you know, politicians and community leaders and municipal governments and provincial governments, and it's been a very interesting process of seeing people actually quoting the report, using that evidence, and all of the things that have come from that in terms of community engagement and program and planning and service delivery and how that's been impacted. And the idea wasn't new, it was the uptake of it, I think, that was really was the really new and exciting part.
And I do remember the first time I looked at some of the data that was coming out of BC, and they were looking at the early development index by neighborhood, and they were starting to notice big differences between neighborhoods. And of course, that could be seen as very stigmatizing to some of those neighborhoods and the children that live in those neighborhoods. But the piece that I thought was really exciting was that when you listen to the story, they started to tell you, well, you know, there are communities where kids entered school at lower levels of development, but that those children progressed. And so what we really want to figure out is what have those magnet communities been doing that have made a difference, and that's how we'll really learn from this information. People are always worried about stigmatizing communities, so you need to think about how you can really tell the story and find out what makes a difference in the long run.
It's difficult for any community group to hear themselves described in the way we often describe communities through these kinds of reports, that a group is the worst off, it's the lowest income, it's the highest crime rate, it's any of those kinds of things that we typically put in reports to describe inequities often describe a community in the worst possible terms. And from a community development point of view, if you're actually trying to engage a community, it's important to, I think, to balance that off with an understanding of, really, so what are the capacities that also exist within that community? What's the level, what's the resilience that exists there? If you're trying to paint a picture of problems that exist, and we're also trying to engage those communities at the same time, it's also important to do it in a way which is, which looks to try to find and help to develop the capacities within those communities. And how can we, and it's not always easy, but how do we do that? And how does that also factor into the way that we're looking at communities and the kinds of indicators we use when we're speaking with them?
There are two sort of areas when we look at social determinants of health. There's the research side of it that can combine people who have, are in the lower end or the higher end or the middle end, and look at their health outcomes and show that it is a gradient for many, many health outcomes, not likely all health outcomes. But on the other side, when you're trying to produce a report that's going to be useful to people in a geographic area where they're responsible for planning and delivering services, it's almost more of a descriptive, I think, presentation of within their geography, what's the picture in terms of the social material deprivation in relation to health. And it isn't as easy to do the statistical comparison because you don't have equal numbers in all of those categories in small geographies. And again, it's going to tell them what they already know in terms of public health, but it gives them that ammunition that they need to argue for more resources.
I think public health units in general, populated by young practitioners in particular, have the opportunity to move together if they reaffirm their commitment to asking the question why.
Good.
So if you ask the question why, and you keep asking the question why, that 5 whys exercise that is sort of a staple of health promotion teaching, right? You will get to the determinants of health in your communities. Yeah. So, the advice that we give our teams in public health and capital health now is, if we see anything, breastfeeding rates in our communities, we should be looking for, are they different at the starting point? And if they are, the only question that we can and should ask is why. And keep asking that question until we come up with a reasonable answer, and all of a sudden the intervention pops up at you. If our practitioners start asking the question why, what comes along with that organizationally, I think, is it creates the space in the organization to start to build the skill sets and capacities and partnerships that will help bring those solutions along, right? My sense is that it has to be the public health practitioners who ask that question.
Interesting.
See, health status reporting is an effective tool to bring about change in health equity. It really gives the community and organizations and sectors the fuel, I guess, for the fire, or the evidence that they need to get the change they want.
If you are the kind of person that thinks that information is power and can really make a difference, then you can take that and really make something out of it, and understanding it's a real privilege to have access to this data and to make it speak to people.